stretch in that direction. All right. So depending on your patient and what their problem is, we do want that area on stretch. So I actually will get you, if you're able to come and just pop your hands onto the bench there. So you need to some flexion through your lumbar spine if you can. So tuck your pelvis under if you're able, the other way. Okay, that's it. All right, so depending on your patient and what their clinical presentation is, we're going to tape along the erector spinae. So I'll measure 2 strips. Now I'm going to show you with the 10 centimetre as well, but for the erector spinae, we're using the 5 centimetre. Now I cut them together so we're really even, and we were chatting in some of the groups when we were talking around the knee, that if you tape one side uneven to the other in terms of stretch or position of the tape, so for example if we tape sort of more like this, or we stretch one really long and one really short, they will feel that increased stretch on one side versus the other. So if you're wanting to encourage rotation or one side to work, then that's fine. But if you're wanting to keep it even, just be conscious of your stretch and making sure that it's fairly even on both sides. Okay, so our application is still the same. We've got our 5 to 10 centimetres. I'm going to go either side of the spine onto the erector spinae muscles in the flex position. So again, we're trying to use the elastic recoil. This is unlike where we were talking about stretching and holding the joint in a particular position. I'll show you that on the thoracic area in a second. And then placing onto stretch. And the last part just place down. Now the nice thing is, because you can see the stretch in the cloth, you can roughly copy it on the other side, so that you start your stretch at about the same point. And if you've taken your backing paper off, you can even stretch exactly to where you want to, rather than going too far and being uneven. Okay, so we've already matched it up nicely. Still going okay? Yeah. Good. Okay, and then if you have a stand for me, you'll see that we get the elastic recoil in that fashion. Okay. Now, what I will add is another strip tool, if it's okay with you, if you're okay with so there. We'll go with our 10 centimetre this time. So this might be more for our discogenic low back pain, where we're wanting to give some support, decrease their pain around that area. But remember, we're not necessarily going to encourage flexion or extension there. So if that's what you're after, that's good. If not, you might choose to angle your tape in a different direction. You can also do fans and all sorts of fancy things depending on what you're trying to support. So I'm going to go across the lower back, allow for my anchor points on each side and a little bit of extra stretch. If you didn't have your 10 centimetre, you could just do 2 strips of 5 just next to each other. Or if you're in the clinic and you only have 10 centimetres, you can obviously halve it and use it as your 5 centimetres. The principles for taping are the same in terms of rounding your corners. I didn't actually mention, I don't think, at the start. Anyone know why we round the corners?
No, they won't do that.
Peel off.
Yeah, so the most common thing that happens is the corners start to peel off, and it's usually because it's got caught on clothing. So once you start that sort of rolling back, if it's within the area that's just the anchor, it probably doesn't matter because the stretch part's not affected. But if it starts to peel back further and further, you're starting to lose your effect of the tape. Okay, it just minimises the reason for it to come off. So you can tear your backing paper in half, tear it back, and you now have it nicely to work with. Now I'm going to do anywhere up to about 80% stretch here. I'm doing it for pain also. I'm assuming that he's got quite a significant acute back pain. So I'm assuming it's more disky. Placing it on stretch. Again, giving it a good warmth. We don't want the ends to finish on the tape because we know it will peel off. So our wings are either side without stretch there. Okay. On each side. Alright. Now if you have a stand up for me, you can see that gathering effect over that spot. Okay. So it's lifted off a little bit there. I'll just give it a good rub so it sticks. But you can see that we're getting that fascial lift around the area. Okay, and it seems to work with pain. Good job. Now, are you happy to be my show you this one as well, and that way when we come back you can all practice. I might get you into a sit.